morning, Roxy Soxy.
Good morning, Tam. Okay, I've got to ask you if you have heard about this.
I have.
Now, you have. You're like,
just say yes.
Did you hear about the lady who was 29 weeks pregnant? She was on a flight from Salt Lake City to Hawaii and
she gave birth over the ocean.
But she did not know she was pregnant at 29 weeks. Now,
wait. I didn't hear that part.
Yes, she did not know that she was pregnant.
29 weeks, I couldn't even fit into a door.
No, and the morning sickness from the first 14 weeks.
She was just I drunk too many margaritas. Probably not good for the baby.
Totally, eternally hungover. Now, I did not know that I was pregnant until I was 8 weeks.
Okay, that's not 29 weeks though, giving birth. But 8 weeks is yes. Have I eaten too many burgers and the gluten intolerance that I suffer from has just given me a bit of bloating. You know what I mean? That's sort of 8 weeks pregnant. And if you're irregular, which I'm actually never irregular, I'm to the T, if not
clockwork.
A day or two, clockwork, to the point where I pee on sticks too. Yeah, I mean you've been there. You haven't peed on the stick with me, but you've held my hand while I did. If I'm 2 days late, I'm just I'm freaked out. But yeah, some people just miss their periods, which I find very strange.
It is strange, but to me, I'm like, oh my gosh, that's pretty far. I mean, that's over halfway through your pregnancy to not know that you're pregnant. And then she had to fly another 3 hours to Hawaii with the baby. Still, they had to make an incubator for the baby and all this stuff. So it was kind of crazy.
I think I saw this on TikTok because that's where I get my real news from. Exactly. And I was really proud that the woman who videoed this poor woman who looked like she was in shock did not show her face, because I was that's kind of, an invasion of privacy a little bit. But then I also thought, where's her birth? Where's her birthplace if you're over the ocean?
Yeah. I mean, what do you put on the birth certificate? Do you just say the Pacific Ocean?
Yeah. You just
in the air?
Yeah. Well, our next guest might have a little more information about all these things, including not knowing if you're pregnant for 29 weeks. This is actually an episode that I have been looking forward to for a long time. We've tried to get this amazing woman on our podcast for a while, but she's so busy talking about vaginas all over the world that it's taken us a while to get her on here. But it's my favorite subject, not just because of sex, but there's so many things to learn about the vagina and your menstrual cycle and, what's going on down there. So I'm just excited to talk to an expert who knows a lot more than I do.
Yes. So she is like the vagina Wonder Woman. I mean, Dr. Jen Gunter is an OBGYN. She's a pain medicine doctor. She's the author of the Vagina Bible, the Menopause Manifesto. She's been featured on the New York Times, CBC Today Show, and The Cut, which is where I first saw her. And I hit her up right away. I was like, Dr. Jen, you have to
tell me about my vagina.
Yeah. I was like, you have to come on our podcast. Yeah. And luckily she agreed. And she has been referred to as the vagina expert, the Joan of Arc of vaginas. And she is going to give us the Vagina 101 with her vagina. And so it's going to be all things vagina.
And how many times can we say vagina in one episode?
Yay, Dr. Jen.
Welcome. Exactly. Let's hear it for the vagina.
Let's hear it for the vagina. So how did you get started on this course, this pathway to all things vagina?
Well, I mean, I think with a lot of things in my life, it probably started out of righteous indignation. So, I got interested in medical school in OBGYN because I was annoyed that all of the people lecturing me were men. And not that any of them were bad men. They weren't creepy Me Too men. They were just men. And I was like, really? And this was the 80s, right? And I just thought there were women in medicine that weren't as many as now, but I thought, really? And so I just, that just kind of stuck with me. And I just thought, women deserve the best and I'm the best. So that's what I'm going to do.
What's interesting is, I haven't had hormone issues really ever until I had my 2 babies, and I was rushed to the ER. I was rushed to the ER last month with a massive cyst in my right ovary. Now, all the male doctors diagnosed me with, before they actually found out what was going on, and a bowel blockage. They thought, I had a bowel blockage. They thought I had a twisted colon or whatever it was. And then when they found the cyst in my right ovary, they kind of just said, well, this is how it is with women. It's constant. Lots of people have this, and sent me on my merry way. And I'm like, but I'm in pain and I need help. And where do I go from here? And what does this even mean? And it just seemed like even now in 2021, such a lack of information when it comes to female health issues. And I put it on my Instagram and I got a flood of responses of people who've like suffered from PCOS and endometriosis and cysts their whole lives and have been misdiagnosed for most of their lives. And I just was shocked that we're still having these conversations when it comes to women's health. And like, why aren't we talking about it? Why aren't we getting the information out there? Why aren't we helping women who are suffering?
Well, I think that's a real complex question because I think it's related to a lot of different things. I mean, I think first of all, there's an inability to talk about women's bodies in general, right? So there's that. And the fact that that many women are dismissed and they have their pain not believed. So there's also that. But there's also, I think, a lot of like misunderstanding about also, and this is due to medicine, I think, being really bad at explaining what they do. So, so many times when we're seeing someone in an acute emergency, we're trying to figure out is, life-threatening, yes, life-threatening, no. And so, the large ovarian cyst causing a lot of pain, it's life-threatening, no. But sometimes the way some doctors say that is it sounds like it's not important, right? So, so they're looking for the bowel blockage or the twisted ovary or those things first, because those are surgical emergencies. And they have to be treated, urgently. And then often what happens, I think, is because medicine has a lot of communication issues. The way it's told to someone is it sounds like it's not important, when really what the meaning is, well, it's not surgically important right at this moment. And those are different things. And even though they sound very similar, they're quite different and can be heard in very different ways. And so I think that that there's a sort of a lot of dismissal, a lot of sort of sucking it up, and just really a lot of, I really chalk it all down to bad communication. And I think that's a big component.
There are a lot of outlets out there. There are a lot of people out there that talk, a lot about vaginas and about women's health, and particularly about hygiene and how you take care of the vagina. Do you use, powders, cleansers, vaginal steaming? There are all of these sort of things that have been going around about how to take care of the vagina. And I was always taught that the vagina is a self-cleaning oven.
I never clean. Do you clean? I mean, this sounds grand. I wash myself and shower, but I'm not having like some regime. Are you?
No, I just do like a shower, like soap and water in the shower, like regular cleaning. But so I always heard it was a self-cleaning oven, but now we were hearing all these reports about people talking about, you should use this cream or you should use this technique to clean your vagina. What is true and what isn't?
Well, anybody selling you something specially for your vulva or vagina is generally full of shit. I guess that's really the, because, there aren't just there is no special cleaning or prep done. And all of this is really a remnant of purity culture, right? So there's a long history of putting stuff in the vagina for a couple of reasons. One, because nobody knew anything about medicine thousands of years ago, right? And they blamed everything that happened to women on the uterus. And how do you access the uterus? Through the vagina, right? So a lot of that is sort of bad history that's maintained. A lot of these products are also astringent, so they tighten the vagina, right? Which is not a good thing. But apparently that gives men some pleasure. Obviously, those are men who have problems. I don't know. But so it's born from that. And it's just been rebranded to sell products in a modern age. I mean, douching is a remnant of, the idea that douching could prevent pregnancy. It can't. But also that, cleaning is needed, and cleaning sort of became a euphemism for preventing pregnancy. So all of this stuff is sort of like a bad game of telephone that's all been mixed up, and it's really just to sell stuff. There is no special care needed for your vagina or your vulva, but certainly not for your vagina. You do not need to put your fingers inside and clean. You don't need to check for discharge. You need to do any of that. And your vulva, really many people are fine just with water, but a gentle cleanser is good. We generally don't recommend soap because soap's pretty drying and can raise the pH of your skin, but I don't recommend soap for anywhere on your body except your hands. A cleanser is better.
So you said that some of these products are about tightening the vagina. As we age, just like everything else, sort of the skin, the elasticity of the skin starts to sag. does our vaginas get old? And is that as sad as they sound? That sounds. I feel like it's the only thing I have left. I had a C-section, so I'm like, okay, at least that's okay. But as we age, I'm like, wow, is it all over our body too? And what does that look like? And also, do women start to get, if you're going to tell me that it does age and it starts to not be as tight, do women suffer like depression from that, or loss of, sensation or sex life? Like how does the vagina age?
So everything ages. Everything in our body ages. Our brain ages, our eyes age, our breasts age, and vagina and vulvas do as well. And so as we age, we lose collagen. And so that can affect elasticity of all tissues, right? That's why we start to get a little sagginess in the faces. That's why we get wrinkles. And so on the vulva, there also are some changes, and in the vagina, definitely. There are changes also related to dropping estrogen levels. And that absolutely also affects collagen. It affects lubrication, and it affects actually the thickness of the cells or the plumpness. And that can also be treated. So it's not something that has to be inevitable. There's definitely medical therapy for it if it's bothersome and problematic. It doesn't happen to everybody, but certainly, people who remain sexually active using their vagina, probably 60 to 80% will notice something. And so, and it can present just as dryness. It can present as pain with sex. It can present as a lot of different things, and there's all treatments. That won't cause depression though.
Right.
People may certainly, the whole process of aging may affect some people, and some people that may weigh on them and possibly be a cofactor in their depression. But I wouldn't sort of blame, I wouldn't ascribe
no sex life with depression.
Well, I think it's all complex, right? So,
right.
If you have depression, that might affect your libido, that might affect how you feel about your body. And these things may sort of become like a feedback loop. But treating a vaginal problem isn't going to treat depression.
Yeah.
Speaking of, since you brought up sex, let's talk about sex, because we
love
sex. We're a very sex positive podcast.
Very.
Here. And yes, we like it. We like it a lot. And let's talk about orgasm, because I think there's a little bit of confusion between a clitoral orgasm and a G-spot orgasm. Can you kind of walk us through actually where the G-spot is and like the differences between the two orgasms?
So there isn't any difference. That's all a big lie.
Oh, it's a myth.
Okay. There isn't like a G-spot. So so we had, the clitoris is much larger than people think. So what you see is the glands, that little part. But the clitoris is actually a really large organ that sort of wraps around the urethra, and also has these sort of two branches that are deep to the labia and kind of around the vagina. And so you can access the clitoris by many different ways. You can access it externally on the glands, but if you touch in the lower third of the vagina and push anteriorly where the urethra is, you may also access the clitoris that way. So they're not distinct things. And the original paper written about it that has sort of been misinterpreted and called the G-spot, really, it's a clitoro-urethro-vaginal complex. I mean, maybe that sounds less sexy, but you basically, there's a lot of different sort of pleasurable tissue in the area. And if one spot feels better for you, that's great. But, all roads lead from the clitoris to the brain. And when we say the clitoris, we're saying this larger structure. This idea that an orgasm with penile penetration, the so-called vaginal orgasm, is better, is an absolute misogynistic lie that's built around the idea that sex is better with a penis. Well, there's lots of people who have great sex without a penis. There's lots of people who have great orgasms without a penis. And so, many women are not capable of having an orgasm with just penile penetration alone. In fact, it's uncommon to. Most people require direct sort of manual pressure sort of to the clitoris with something more than a penis. So that doesn't mean they're abnormal. They have great orgasms. And, so I think it's important to get away from the concept of a clitoral orgasm and a vaginal orgasm, because they're not really correct terms either. It's all the clitoris. You might be accessing the clitoris in different ways. Like, for example, if you put a vibrator on your labia and that brings you to orgasm, well, that's because it's stimulated the clitoral tissue beneath. And that orgasm is no different than, an orgasm that's achieved with penile penetration. Now that's biomechanically speaking, it's really no different. Now, how someone sex though is also like how you feel about your body and closeness and other things. And so an orgasm with a vibrator might feel different than an orgasm with your partner, but that's kind of like ice cream flavors. One's not better than the other. You know, there's lots of great ice cream flavors.
Tammin, we don't need a roadmap.
I literally, I just like had this, like everything. I feel like everything I've known my whole life has been like completely wrong because I only had a G-spot orgasm with my husband. And I thought, well, sorry. Again, there's no such thing as like through sex, but maybe, like you said, it was because I felt safe and comfortable and open and whatever that means, that my body was able to receive the orgasm in different areas than I hadn't before, because maybe there was a complete glass in front of me or a boundary that I didn't want to go there. So I was only accepting a certain type of orgasm. Who knows, you know, but this is completely eye-opening.
It's also possible that his penis was shaped in such a way that just fit really well for you.
He's very happy right now.
Right. So they've actually done MRI studies of people having sex to look at what's getting hit.
As they're having sex?
Yeah.
Wow.
Yeah. And so so in general, so people are going to get different. So if you think about the clitoris as sort of this like inverted wishbone that sort of sits on top of the urethra, right? That and kind of wraps around. It's intimate. Everybody's still shaped a little bit different, right? Like, so for some people, the penis is going to provide a lot of pressure on some of the clitoral tissue. And so for some people that'll bring them to orgasm, but other people are going to require, more manual or direct stimulation. And so that's the great thing about sex is you get to try all different ways and whatever I think it's really important to get away from this like right or wrong idea. And that's what happens, I think, when people talk about clitoral or vaginal orgasms. It's like this idea that a vaginal orgasm is some kind of like zenith. Well, we only believe it's a zenith because Freud said that was the only mature orgasm, and it's because it needed a penis. Right. So it's just really about what feels good. If you're having a good time and it feels good, great. If you want to try something else, you should. If you don't orgasm with penile penetration, there's nothing wrong with you. That's very common.
Do you have any tips on how to have multiple orgasms, or is that just like it's just different for every people, for every person, or is there something you can do when it comes to your actual vagina that can help you have multiple orgasms?
Well, I think it's important to sort of say, many of the things that we believe about sex are because of what a patriarchal society has told us, right? So a patriarchal society wants a woman to have sex just with a penis. A patriarchal society wants a mighty penis to not only bring her to orgasm once, but multiple times. Why? Because that makes the man feel better, because it's like metric driven. So I think that instead of thinking about metrics, like how many orgasms did I have or how fast did I have it, you think about how much fun did I have? How much pleasure did I have? Was this a satisfying experience for me? So I would say to think about that. Now, if you're wanting to try different things, to say, oh, well, maybe I want to see if I can or can't have more than one orgasm. Well, that's fine. That's great. The sex is about trying new fun things. And so that's okay. But I just want people to think that if that doesn't how their body works, there's nothing wrong.
Right. They're not a failure.
Yeah.
I want to ask you a little bit about masturbation too, okay? Because
we're going there today, Roxy Soxy.
We are on the way. So with masturbation, a lot of times people you can use your hand, you can use a vibrator. There's all different ways. But there's a myth going around, and I don't know if this is true or not, that if you use mechanical stimulation like a vibrator, that you will eventually become desensitized. Your clitoris will be desensitized, you won't have as intense orgasms.
So who profits from that myth? Men. Right? Men profit by saying, oh, nothing is as good as my penis. Right? So you need to always say, whenever you hear a myth about the vagina, who profits from that myth? Does it make a man feel better about himself, or does it make a woman feel better about herself? Right. So that myth favors the man. So yeah, it's bullshit. I mean, of course not. Does anyone ever say to men, well, if you jack off too many times, that's going to affect your pleasure from having a natural erection from being around a woman?
Right.
No. They don't say that.
They don't say your hand is going to get broken. None of that. Wrist.
Right.
I feel
Right.
like there's
Spray-
such a sexual awakening right now for women, and maybe it's been there all along, and I just haven't been privy to it.
Mm.
But I feel like women are feeling more comfortable talking about sex, talking about self pleasure, talking about like even promoting vibrators. You see people like, Gwyneth Paltrow, she now has a line of vibrators. So
Yes, you can pay more for something that's
yeah,
not approved. That's like
it looks
Goop
very
mantra.
slick.
Hey, I mean, the way she advertised that, it looks less sexual. Like, what is wrong with you? That's the whole point.
Right.
Like, her vibrator's intellectual. What are you even talking about? It's about getting off. It's
Yeah.
not about like reading Proust.
So, like, why do you think women are now coming into this sexual awakening? Like, what has happened? Are we just starting to come into our own power? Like, what was the catalyst to us, like, starting to own our own sexual prowess and lives? Because I do feel like there's been an explosion of it lately.
I think that, there's just different waves of feminism that have moved the needle forward. And I think this is just kind of part of maybe one of the next waves. And I actually would give a lot of credit to a lot of amazing sex educators and sex therapists who put out a lot of really good content on social media. I follow a lot of different ones who are fantastic. And, they're, good sex therapy breaks down a lot of these, myths and misconceptions and gives people, sort of honest spaces. And so I think that, now we're able to talk about those things as opposed to being banned, right? So, if social media were around 20 years ago, none of those accounts probably would have been allowed. I mean, even now, some of them get shadow banned now and then from using words. But so I think that society, I think there have always been people having these conversations. I think society is now able to tolerate them in public spaces. So I would sort of say that, how when you light a piece of paper, it takes a while for the flame to catch. So I think the flame has been taking a while to catch about this. I think it's always been there, but it's just needed, now we're at this point in time where we're allowed to have these conversations because of, all the hard work that people have sort of like done before. So I think it's kind of a culmination of a lot of things.
Yeah, we got to carry it on. But Tammin and I, we both have daughters and they're young now. I mean, they're 6 and 7, but eventually they're going to get to be, preteens and teenagers and become sexually active. So for these girls sort of coming up, what are your thoughts on the HPV vaccine? Do you think that is necessary for these young girls coming up, or what are your thoughts on that?
Yeah, every single person should get vaccinated for HPV. Absolutely. Everybody, all genders, age 9 to, 12, get vaccinated. You bet. We have the chance, everybody talks about wanting a cancer moonshot. Well, we have one. We have one to eliminate cervical cancer or reduce it dramatically. And we're not only reducing cervical cancer, but all of the awful testing that happens when you're diagnosed with a precancer. People forget about that. Sometimes women have to come in for biopsies and colposcopies, which can be painful for years, but they never actually get cancer. But that's a burden. That's a huge, awful burden on them. And, and then there's anal cancer. And, we know that later in life, in sort of the 40s and 50s, there's a spike of HPV related throat cancer. If we can prevent HPV exposure for people in their teens and 20s, from oral sex with reducing HPV, then, we can maybe reduce that burden of throat cancer down the road. We don't have that data yet, but it's an incredibly safe vaccine. There's absolutely no reason not to have it. And, this is, as someone who's seen many people, traumatized physically and mentally from HPV related diseases, absolutely get the vaccine, get your kids vaccinated. Both my sons are vaccinated.
Oh, okay.
So talking about the vaccine, Roxy and I are fully vaccinated. Yay for COVID.
Yay.
And I know there's been a lot of misinformation about fertility and the vaccine. I have at least a handful of women who are trying to get pregnant or who are pregnant who are foregoing the vaccine, the COVID vaccine. I do have some that have got the vaccine as well. So what is the misinformation that's out there, and how can we debunk that?
Well, I think it's really important to point out that pregnancy is the worst time to have COVID, that there's a significant increased risk of having complications from COVID when you're pregnant. And a few weeks ago, a colleague in Toronto was tweeting that at their big sort of tertiary care hospital where they take care of all the sick people, 50% of people in their ICU were pregnant with COVID.
Oh my
Okay.
gosh.
So this is something that we know is really serious. We know this the same with influenza. So many respiratory viruses are really bad in pregnancy. And so, that's a concern. So, the COVID vaccine is, we've seen historically with vaccines, lies about fertility and lies about, risks for women. This is all, again, part of a patriarchal narrative. Why is nobody concerned about risks for, men, right? It's all about, purity and frightening women about, purity culture and pregnancy myths. But, there are no safety concerns with the vaccine. It's something that is, really, something that we know biologically, and people have this misconception that it's sort of new, but mRNA vaccines have been around actually for 10 to 15 years. They've been studying them for rabies, for HIV, for a few other infections as well. So we have a lot of data on them, and biologically they're really quite safe. So, obviously we have limited data on pregnancy, but we're accumulating it. And I think that certainly someone trying to get pregnant, I would say absolutely, you want to now's the time to get vaccinated, right? And during pregnancy, I mean, I think people have to make, because we don't have great data, people have to obviously make a decision that works for them. However, the American College of OBGYN feels that it's safe for pregnant people to get vaccinated. And I think that you have to look at your own individual risk. So if you're a pregnant person who works in a hospital, and you have a high risk of being exposed to COVID, you're living in an area of the country where there's a lot of problems with COVID, you have a different risk than maybe someone who works from home and you live in an area where there's very low risk of COVID. But generally, I think people can be assured that there are absolutely no safety concerns that we can see for, for women of reproductive age, postmenopausal women, or during pregnancy.
Also speaking about, the cervix, kind of going back to that, how often should we be getting pap smears? Because one time I was in the doctor, I believe it was either last year or the year before, she was saying that, some people are getting them every year. Some people are now dropping back to every other year. What are your thoughts on that?
Well, the recommendations are certainly not every year. It's every 3 years, starting at the age 21. Yeah. And that's because, we now know that the cervical cancer takes years to develop. And when you test people too often, what happens is you pick up minor abnormalities that would go away on their own. And so, so it's really important for people to see that, that, and then at the age of 30, we add in HPV co-testing, and that also adds another. We don't recommend testing younger, like 21-year-olds for HPV because it's so common. Right. So the recommendations are definitely not every year. If some doctor's telling you need a pap smear every year, and that's assuming you don't have a history of abnormal pap smear, because this means I'm talking about like the general population. Someone who's had an abnormal pap smear may very well need follow-up once a year for several years. That's a totally different situation. But yeah, the general population, you do not need a pap smear once a year. And if anyone's doing that, they're doing it to try to make money off of you. So
that's so interesting, because I thought I must book my pap smear because it's been a year and 2 months, because in your head you think every year is when you should go in. So I'm under the age of 40. When should people start to get mammograms, and are we doing them too late these days, or is 40 around the age when people should start getting their breasts checked?
Well, the guidelines sort of vary depending on who puts them out. So generally what we recommend at age 50, it's every year. And between 40 and 50, it's kind of like every 1 to 2 years, depending on your individual risk factors and how you feel about it. And so, but if you have a history of breast cancer in your family, then the recommendations may be different. Someone with a very strong history of breast cancer, might need to have, or we may recommend genetic testing. So there could be other things, but generally sort of around the age of 40 is when we recommend testing start, and, every kind of 1 to 2 years.
Tammin and I haven't gone through menopause yet, but we know people who have. Obviously.
I'm very afraid of it. I am not the nicest around my period.
Yes, we're a little scared. We hear all these horror stories, right? So we hear about, night sweats, hot flashes, extreme vaginal dryness, so that sex is painful, just all these horrible, horrible things. And it scares us, like it scares people who haven't gone through it yet, because you just hear all these horrible things about menopause. So is there a way that we, before we even go through it, is there a way that we can start preparing our bodies so that when that time does come, it's not as, traumatic for us.
Yeah. So you only truly hear the horror stories, but that's about everything, right? People only talk about their terrible puberty or their terrible periods or their terrible vaccine experience, right? You never hear people who have a good experience really talking about it. So I think that's the way we often share information. So I think that's important. But yeah, if people want to be prepared, they should buy my book, The Menopause Manifesto.
Yes, buy this book.
I think that we've been taught to fear menopause because in a patriarchal society, our worth has been tied to our ovulation. We have basically been distilled to being broodmares, right? So if you're taking away the thing that the patriarchy thinks give you power, then you become irrelevant. And that's really just not the case. The least important thing about a person with ovaries is their ability to ovulate. Like that's like your toenails are more interesting than your ability to ovulate. Like that's just something that, we don't think that a 9-year-old girl is less because she doesn't ovulate. So why would we think that a 54-year-old is less because they don't ovulate, right? So I think it's important to reframe it and talk about more like crossing the Crimson Bridge than, than saying it's awful. So menopause does have symptoms. Sure. People can have hot flushes. They can have night sweats. They can have vaginal dryness. Those things can be treated, right? So we have modern medicine for a reason. Menopause also starts a sequence of events that increases your risk for osteoporosis and for heart disease and diabetes. But there's things you can do about that. So, I think that we talk about menopause in this fearful way because that has suited a patriarchal narrative, because men are uncomfortable with women's bodies and they don't even want to hear about a body that isn't sort of quote, quote, feminine forever. So, I think that we just need to sort of reject that hypothesis and just start talking about it. And look, this is just another phase of life. And it's no more, it's doesn't mean it's not a sign of your irrelevance. It's not an expiration date. It's something that happens to everybody with ovaries. And it's certainly not the end of life.
I didn't realize how much of a stigma there was surrounding just periods in general. I have a high social media and I have a lot of young girls on my social media, and I talk about my period because I've had hormone issues and I've been trying to balance them after I've given birth. And so I talk about periods and I talk about menstruation, and it's like I get the feedback in my direct messages. Oh my goodness, thank you so much for talking about something that I've been ashamed about my whole period life. And I was actually quite shocked. I was so shocked that, like, what do you mean? Like, every single woman bleeds. And yet we find it, almost embarrassing, shameful, vulnerable to talk about. And I'm hoping that in the future, because there are, and this is what I want to talk about, products now that are, there's period cups and there's period undies and there's brands that are really opening people's eyes of like, you don't have to keep this a secret. We can sort of let our red flag fly. So I'm glad that it's moving in that direction.
Yeah. I mean, I think there's overall been just a cultural secrecy about women's bodies and periods specifically because it's messy, it's gross, according to the patriarchy. And it's also a sign that you could be impregnated. So, gosh, we need to protect you. Historically, women have, like thousands of years ago, were believed to have problematic bodies, that our bodies were less capable than a man's body, that our tissue, the actual tissue that we were made up with, was moister, and that our uterus was a problematic animal. They used to think that the uterus was like a wild animal inside a wild animal. So women were like double wild animals. And, we're not so far removed from that awful thinking. And so, the way to break it down is to say, look, yeah, it's a period. Like, if that grosses you out, you have a problem. Like, what is wrong with it? I mean, that's why, I did my TED talk on periods, because they're just, people don't even like understand why periods are so heavy. Like, there must be a biological reason, and there is. And, people should have access to that information. So. Yeah.
And people don't have sex during their period. That's such a taboo to even like, well, a lot of people I do, but a lot of people I know don't, like women. And so, that needs to be debunked as well. Like, sex during your period is wonderful for a lot of us.
Yeah. I mean, that's why they make navy blue towels.
Yeah.
Is that
Good
why?
point.
Now I know, because I was always like, that is just a horrible color to have in my
I
bathroom.
know, like who wants, because you get a little bit of bleach on it and then it's stained. But yeah, I'm convinced that's why black and navy blue towels exist. So you got your period towel, you put it down on the bed because, like, let's be honest, you don't want to, who wants to wash the fitted sheet if you don't have to?
Yeah,
Like,
exactly.
folding that thing is just too much. I'm sorry, I'm a bad laundry folder. So yeah, you get your period towel. It's like,
that's
bring
wonderful.
out the navy blue towel, baby. And so, yeah, I think that, but again, women have sort of backled their whole lives, their whole reproductive biology to make men comfortable, and why are women ashamed of having sex during their period if that's what they want? Well, because they've been made to feel ashamed by a patriarchal society. So I think that's, and often we forget that patriarchal society has been perpetuated by women. Right. If that's how you've been brought up and that's how your mother was brought up and everybody was brought up that sex on your period is wrong and dirty and could hurt you, then it's no surprise that you would think that.
So interesting, because during our period, during our cycles, there are a lot of different things that you can use, to control the blood flow or, you for your personal hygiene. And personally for me, I use organic tampons. But there's a lot of people that I've heard, are not fans of tampons. They say, it's bad for your vagina and your overall vaginal health. What are your thoughts on some of the products that are out there, be it the pad, the tampon, the period cup? What do you think about these?
Underwear?
The underwear.
Well, yeah. I mean, organic tampons are a scam. Like they're not
Are
better
they?
for your body. Yeah. There's no like pesticide residues in tampons. Who's telling you that? The people selling organic tampons.
So it's BS then.
The people selling organic tampons have not submitted any data to the FDA saying that their product is different. Or,
they're so much more expensive.
Yeah,
right.
Exactly.
Every tampon gets approved by saying it's the same as previous tampons on the market. They don't have any data. They haven't published any data. It's all a scam. If you want to buy organic because that fits with your life brand, well, sure, whatever. But I put regular Tampax in my body for 30 years. Like it's not like there's no pesticides or harmful residues. And that's all created by people who's selling you the more expensive alternative, right? So, so keep that in mind.
Okay.
So there's lots of different period products. People should use what they want. I think there's great options available. If you like menstrual cups, great. If you like tampons, great. If you like pads, great. If you like period underwear, great. I might not, if you have a super heavy periods, they might not work well enough, but they're great. They're great for people with light flow, and they're really great for people that, have heavy flow and might occasionally leak through a tampon or, that type of thing. Because it's just the thing with period underwear is like, if you're someone who has to change a tampon 3 times in a day, you're going to have to change your period underwear 3 times during the day. And those things are expensive. And then you're going to take it off at work and then put it in a baggie and take it home. Yeah. So you kind of have to like work through that. But if you're like a 13-year-old with irregular periods and you're just starting school and you don't know and you're worried that what if my period starts? Gosh, period underwear is fantastic. You don't have to worry. You've got that on and it's gonna, it's gonna, if you get your period when you don't know when you're gonna get it, because that's what happens when you're a teen, you've got some backup there. So yeah, I think options are great. There are people who like reusable menstrual pads. There are people who make their own reusable menstrual pads. Great. The more options, the better.
So how do they make the reusable ones? Is it just out of cloth?
Yeah, it's just like a cloth diaper, right? The same material, absorbent material, and it's sewn into a pad shape. And often there's several layers. It's like a terry cloth kind of material. And then usually there's snaps and they go around the underwear and then snap on the other side.
Am I going to catch you at the sewing machine now? Making tampons for us with women on top branded.
Oh, I love it. That's going to be our new product to sell. Women on top, reusable pads.
But there are also some options that are dangerous. So for example, you can buy crocheted tampons on Etsy. So don't use those. Yes.
Ooh.
Don't use sea sponges. Those are also not safe and not recommended. So, you have to remember that the word natural is just a marketing thing. It's not anything medical. It doesn't mean anything.
That is incredible to know. I've
Wow.
wasted so much of my money on natural products.
I mean, the word natural literally has no meaning. It's
Right.
like it can mean whatever you want it to mean. And when you think about wellness, think about all the marketing terms they use: good, clean, pure, natural. Those are the exact same words of purity culture.
We are being fed, spoon-fed something that we don't even know is in our subconscious brains.
Yeah.
I want to talk about periods and if there's such thing as a healthy looking period. I've always heard that, really rich red blood that's not clotted, that isn't, that doesn't come in waves is like the healthiest form of a period. Is that a lie? And everyone has
that's a lie.
differently. And
Yeah,
are clots okay? Are clots not okay? Is the color okay? Is the color change for different people? What does a healthy period look like? Or are they all versions of that?
Yeah, the color of the blood has nothing to do from a health standpoint. That's a really common lie you see on Instagram. So the color of the blood has nothing. Some people have clots, some people don't. None of that means anything. What matters is the volume. So if you're soaking your clothes, if you're soaking through your period products, well, then the volume might be too much. If you're bleeding for very long periods of time, more than 6 days, those are times to sort of definitely report your period, because you could be losing too much blood. You could be having an abnormally heavy period. But there's no ideal, that's a completely made up fever dream from, I guess, naturopaths or somebody, I don't know. But there's no special color that your blood should be. I see all these charts circulating on Instagram all the time, and it's all made up.
Oh, wow. So kind of along with that, I know a lot of women get a little self-conscious when they have their periods because they feel like their vaginas smell or there's some sort of an odor. So are vaginas supposed to smell? Is there supposed to be kind of an odor? Is it supposed to be odorless? Like what? And does that have anything to do with your health?
I mean, there's no abnormal smell with menstruation. There are definitely maybe are men that are squeamish about blood. And I think that's a really important thing. I see women every day. I walk into rooms of people who are having heavy periods, and there's no period smell. I don't walk in and go, ooh, well, I can tell you're on your period. So I think that's a really common myth. If you're having a lot of bleeding, might you smell some blood? Well, sure. If you cut yourself, you might smell some blood as well. But nobody goes, oh my God, I can smell blood when you cut yourself. So, I think that, bodily functions have smells, and they're not abnormal. They're bodily functions. We've made them abnormal because that benefits the narrative of telling women that they're dirty and their bodies are problematic.
Why is there such I just thought about this when we were talking about the ovarian cyst. Why does it seem like there's such an uptick in women who are suffering from menstrual issues like PCOS, endometriosis, cysts? I feel like I hear it, and it's more of a common subject that people are suffering with these issues. Is it happening more, or are we just talking about it more?
I don't think I think part of the problem is, many of the studies from kind of the 80s and the 90s are maybe not as good quality. So is it truly an increased incidence, or are we just talking about it more? I would suspect from a standpoint of endometriosis, we're probably just talking about it more. It's probably becoming just a greater awareness. I don't think the incidence is truly increasing.
What can people do?
Well,
do you have any?
Yeah, that's not really
tips?
a question I can kind of answer, because
Right.
it really requires a consultation with the person to find out what's bothering them, what's going on, what they've tried before. So, I would say that, if you're having menstrual cramps that are disabling and that you're not able to function, then you should see your provider. And it may be as simple as taking ibuprofen a few days before your period starts. It could be that the birth control pill will help you. It could be that IUD with the hormone progestin, like the Merino, will help you. And it could mean that you might need surgery to see if you have endometriosis. It could mean that there's another cause for your pain. So sometimes people can get muscle spasm during their period, and that can be the cause of their pain. So it's really requires an assessment to kind of see what goes on. What do you find on exam? How much someone's disabled by their, by their symptoms, by their pain, what treatments they feel comfortable taking. So it's not really something that can unfortunately be summed up into kind of like a one-liner.
Right.
As I mentioned before, Tamina and I have 2 young daughters, and Tamina has another one as well. And, sex eventually is going to come up as a topic at some point. My daughter has already asked me, where do babies come? Like, where does a baby come from? And I sort of used gardening terms. I said, well, daddy planted a seed in mommy's tummy and there you grew, trying to make it pretty basic for her right now while she's 6. But, at some point we're going to need to explain sex. And I'd rather it be me than like her friends. So what is the best way to kind of explain it like that? I mean, for me, my background, my dad's an oncologist. So I come from a very medical family where we use like all medical terms and things like that. But is that the best way to explain sex to your kids? I don't know.
Well, I think, for just sort of someone starting out, I mean, I think it's important to just use anatomical terms, to not use terms like down there or your private parts or your special parts, to call it the labia. So we're going to wipe your labia, and, you don't have special names for toes or fingers or your nose. So why do you need a special term for your vulva? You need a special term because the patriarchy tells you it's something that's shameful or, needs to be protected from men. Right. So just use body parts. And, I think that a good rule of thumb is to explain things correctly, to sort of maybe go away from euphemisms if possible. And as soon as you just talk, and then as soon as they start glassing over, stop the conversation because you've told them what they needed to hear. You don't need to keep going and going. So the kids will be ready when they tell you. So, you can start explaining it. And if as soon as they look like they're tuning out, then you don't even have, you just move on to the next thing. And there's also so many great books that explain things. I mean, there are people who are professional educators, sex educators who know how to explain these things to kids in really good terms. So, I would think, look for a book that speaks to you, written by somebody who, has good training. I think those are really great things, kind of leave around the house. And when kids are interested, they'll pick them up.
Is there
my fear though? Yeah. My fear is that you tell them, a penis goes into a vagina and then sperm through pleasure ejaculate. I don't know if, being able to talk to a kid like that, which is the correct way to explain sex. My fear is, does it not make them curious? Does it not make them more sexually in tune if they really know what's going on? And again, we can't hide it from them forever, but maybe there's an age that you start to.
Yeah, what age is that?
Maybe they find it, but then if you don't tell them, I'm sure they'll find it out somewhere else, right?
I certainly educating young children is not my area of expertise, but I am unaware of any data that supports the idea that telling kids makes them go have sex. So when you'll tell your 9-year-old how to drive safely, and no one's worried that means that a 9-year-old's going to go steal your car and go for a drive. Right. So I think kids sometimes try things because they're curious. And if they have information, then maybe they're less curious, So I think that there's probably, age appropriate ways to discuss it. Certainly, I think kids will sort of let you know, I think, when they're ready. But again, this is not my area of expertise, is sort of, educating 3, 4, 5-year-olds. But my kids have always known. I mean, because I have models of vaginas and things around the house. They hear me have conversations, and, they're totally like nonplussed by any of it. So they're 17. They seem to turn out okay.
And did you, what age was that they sort of like knew what sex was, or when you explained it to them?
I don't know, probably like forever, because I just have always this has been my job their whole lives. Right. So they've been exposed to it. I mean, we were at a baby shower when I think they were 5 and someone was talking about how the stork was going to bring the baby. There were kids there as well. And one of my sons said, storks don't bring babies. They come out of vaginas, except us. We were cut out of our mommy's tummy with a knife, not a fork. It was like very specific that it was a knife, not a fork.
Yay, C-section here too. We're all
I know,
C's. We're all
C-section
C's.
babies.
You know, and he was
Yeah.
like, he said the word vagina. He didn't think anything like you say the word vagina, like it's not like,
Yeah.
if you would say the word mouth, like, why is it wrong to say the word vagina? So, I think, to really answer how you should do it, you probably need to talk to a sex therapist or an educator who does that. But certainly I don't think that there's any literature to support telling kids the truth about sex makes them run out and increases their risk. In fact, if they know about it, then if they happen to come across some predator, then they would actually know what's happening, and they'd be able to say, maybe they'd be better able to tell someone what someone tried to do. So, then it wouldn't be shameful and they wouldn't hide it. And, so yeah, you might need to talk to someone else, but that's my 2 cents.
And I also feel like, everyone needs to start getting on the same page, especially like how they teach at schools, because what happens is you're at that party and then just say it's my kid who's like, no, a penis goes in a vagina. Then all of a sudden I'm the pariah and no one wants to be because all the parents are like, great, you've the cat's out of the bag. Now everyone knows how a baby's made. So like, yeah, it's getting that information out, talking about it more, having people more on the same page about like, it's okay to talk about the, penis, vagina, sex. Have those conversations so it's not so taboo that like we're all giving different information, so all kids are confused all the time. So if we all just start to go in that direction, I think it would be a lot easier for all of us as parents, right?
Right. Yeah, it's true.
Yeah, information is power. And learning about your body isn't shameful. And I've had people say, oh, can you keep that down, or talking about the vagina or whatever in public. And I'm like, no, like, if you don't like, if you're if you're eavesdropping on my conversation and you don't like what you hear, I don't actually care. So yeah. So I think it's just facts don't hurt people. Lies do. I think that's facts give people information so they can make choices. They know what's happening to their body. They can be empowered. And lies do the opposite. So,
well, speaking of lies and truths, Tammin, should we do some myth?
I know. I was thinking about that. I was like, we should let her go, but then I was like, but then we kind of have to do a myth buster.
Yes, let's do some myth. If you're a game, Dr. Jen,
just a couple questions, and then you are all good to go.
Okay.
Yes. And if you are watching us on YouTube, guys, go over to iTunes, Spotify, wherever you get podcasts, so you can hear Dr. Jen bust some myths about vaginas.
Thank you so much for being here.
My pleasure.
I'm reassessing my whole life right now and all the things that I thought I knew for 37 years. But where can people find you? Can let them know about your books, where you are, where you're speaking, so everyone can follow your journey.
Sure. So I'm at Dr. Jen Gunter on Twitter and on Instagram, and Dr. Jen Gunter on Facebook. I have a Substack called The Vagenda with a J. I write about feminism, medicine, health, politics there. And I have the Vagina Bible, which came out in 2019. And May 25th is when the Menopause Manifesto comes out.
I love it.
Yay.
Well, thank you so much.
All
and
right,
guys, you can find us on Women on Top Official on Instagram.
And Women on Top Podcast on Facebook. And we have a Women on Top group on Clubhouse. And don't forget to rate, subscribe, and comment, and let us know who you want us to have on the show and what you want us to talk about.
Yes. More vaginas, say.
Vagina. Will you come back again? Dr. Jen, will you come back again and visit us?
Please.
Sure, absolutely.
Yay, we love it.
Okay.
Well, thanks, guys, so much. I am Tammin Sursock.
And I am Roxy Manning.
And we are Women on Top.